results. And really, this is the most significant single source of data of youth reporting what they are seeing, hearing, and saying about youth substance use. So really important, looking forward to it. So I'll turn it over to Megan and Lauren.
Thank you, Peter. So Megan, you can go to the second slide once you get it up. Can everybody, oh, there we go. All right, makes it easier for people to read. There's actually two assessments that we have done in this region. Back in the year 2000, the region banded together and said, we need to do a teen assessment. There hadn't been one done since the day survey done by the United Way in 1987. So in 2000, we did the teen assessment project, which was created by the University of Wisconsin. It's been used throughout the nation in different pockets. It is valid and reliable measures. What that means is the questions have been tested to make sure that they accurately assess what you want to measure, and also that the people participating understand what it is that you're asking. The TAP, as we call it, is more culturally appropriate for middle school populations because it doesn't just look at the hardcore risk factors, but it also takes a look at what are some of the protective factors. And so the schools in the region find it very, very helpful because it looks at school connectedness and connectedness with parents and whether they feel rules are enforced fairly. All of these measures that help schools as well as our region understand how we can help some of our younger teens in the region to be able to head toward a healthier life. It does cover more topics in the YRBS. And as I said, we did it in 2000. That was region-wide grades 7 through 12. We did 9,000 youth that year. Then the state went to the Youth Risk Behavior Survey and started to offer it for free to high schools. And so since 2000, high schools have been using the YRBS. So in 2012, the middle school principals got together and said, we need to know what's happening with our younger teens. And we took a look at about 15 different surveys out there, and they went back to the Teen Assessment Project. So in 2012, we did TAP with the SAU 29 middle schools, the 4 of them. And then in 2016, other middle schools said, we would like to be involved in that process. And so we did it with 10 middle schools in the Monadnock region. In 2019, we wanted to do it again. The middle schools wanted to do it again. However, that's where politics come into play. In that time, the legislature changes state law so that you have to have written parent permission for any teen survey, well, for any surveying in the schools other than the YRBS. And I have to give Jay Kahn credit here because he tried to get that law changed. It was voted to have that change back to passive permission, which means parents can opt out, but the governor vetoed it. So we only had 6 middle schools that were able to get enough parent participation permission for that to happen. So what we had was 106 students from Keene Middle School and from the Monadnock Regional Middle School for the 2 that I'm looking at now. I didn't include the middle schools or high schools out of the region of the Y Coalition. The Youth Risk Behavior Survey is the other survey. As I said, the state offers that to every high school in the region. It's offered every other year. It is national. The Centers for Disease Control is the one that controls that. They set the core questions, and New Hampshire can add some additional questions to it. 2019 is the last year it was done. It was supposed to be done in 2021. Again, it was done nationally in 2021. New Hampshire has decided to go electronic, which is a positive change. But in doing that switch, it took them more time to gear up. So currently the plans are for this to be done again in the fall with the high schools in our region. So we're going to be taking a look at Monadnock regional results, regional high school results, and Keene High School results. Can we go to the next slide, please? So I'm going to take a look at middle school results first. And as I said, it's more culturally competent because we're looking at more of the underlying issues with teens' lives rather than just the risk behaviors. And so you can see our middle schoolers are generally pretty healthy. Over half of them enjoy school. That's a strong protective factor. Connectedness to school not only has positive health consequences, but also school achievement consequences. Well over 3/4 say the parents are interested in what they're doing at school and how they do. 9 out of 10 feel that there's lots of opportunities within their school. 2/3 feel comfortable talking one-on-one with a staff member. So if they have a problem, there is an adult. You know, they can talk to their children, their parents at home, but they also can talk to a staff member at school during the school day. So as you continue down through, you can see well over the majority and all of these protective factors do exist. One of the problems that we have with middle school is 7% of our middle schoolers were vaping, but that was the highest substance use. Everything else was less, only 3% have used alcohol. So that's a very positive thing. Another advantage of the TAP was we could take a look at why do they think their peers choose to use substances. And over 1/3 said their peers choose to use substances to look cool. A 1/4 said to feel better when they're depressed or stressed, and 18% said to fit in. If we take a look at the next slide, you can see here, once again, this is still middle schoolers. This is for the region. And you can see if you take a look at the orange bars, those are ones that said that that's the greatest worry. And so it's very common things like getting good grades. That's not an unusual worry. So that's not something that raises a red flag for us. For having enough food, that is a little bit of a concern in our region. We know food insecurity is a problem, and 1/3 of our middle schoolers were worried about that. But then it drops. It's still about 1/3 for how I look, and then it drops down to 10% in some of the other more higher worries, if you will. If you take a look at the bottom of this scale in this slide, those are the teens that are more at risk because they're looking at things like getting along with their parents, being pressured to use substances, being pressured to do things that they wouldn't want to do. And so those would be the more at risk middle schoolers, and those would also be the ones that would be more likely to be using substances. If we go on to the next slide, this still is middle school. This is time use. And if you take a look at the very bottom of the slide, spending time with family is the most popular thing, that they're spending 16 or more hours a week. That's a huge protective factor. It's important for them to spend time with their family. So we feel good about that. And time with friends, if you take a look at it, it's between 15 and 20%. The 2 bars here, the gold bar is Monadnock Regional, and the brownish bar is Keene Middle School. Spending time with friends is also very typical for that age group. The concern would be then the other more common ones are through screen time or electronics, and it's questionable the quality of the interaction that they're having with those. The other concern that we have is more than half say their primary location for using electronics is in the bedroom. That means that there's less monitoring there. 41% said that they knew somebody that was really hurt by cyberbullying. But on the positive side, which means schools are generally doing a pretty good job, only 10% at Keene Middle School and 32% at Monadnock said that they social networked during the school day. The next slide. So if we take a look at where our state fits in substance misuse, New Hampshire has a problem. We are highest in per capita consumption of alcohol by pure alcohol volume. We're at twice the national rate of use. 4.72 gallons per capita is the usage rate of New Hampshire. That's not something that we want to be very proud of. And it's the third leading cause of preventable death in our state. Next slide. And what that means is that all of the substance misuse impacts our youth. And if you take a look, this isn't just using substances, this is substance use disorder, 12 to 17-year-olds, and we're still very high in the nation. We're in the highest ranking with this. We have more teens die of alcohol use than any other illicit drug. It causes unintentional injuries such as falls and drownings and motor vehicle accidents. It leads to violence, alcohol poisoning, and other poor decision making. So it is a huge concern for us. Next slide. But it's important to realize that it's not all of our teens. These are the norms for the Greater Monadnock region, which is our public health network. This would be the not only Cheshire County, but also the parts of Hillsborough County that are in our public health network. 7 out of teens do not drink alcohol regularly. 4 out of 5 do not binge drink, which is 4 or more drinks in a short period of time if you're female, or 5 or more if you're a male. 2 out of 3 believe that there is risk in binge drinking. 3 out of 5 have friends thinking it's wrong to drink. 4 out of 5 have parents who think it's wrong to drink. So there are some positive norms in our region, and the majority of our children, the majority of our teens are not involved in the high-risk behavior. So as we delve into this, I want you to keep that in the back of your mind. This is not all teens. It is some of our highest risk teens. Next slide. If we take a look at regular use of substances, the substance of most concern now is vaping or e-cigarette use. And if you take a look here, for the rest of the slides, these colors will be consistent. Keene High School is orange. Monadnock Regional High School is gold. The brown is the Greater Monadnock Public Health Region, and the green would be state. So if you take a look here, our 2 high schools within the Y Coalition focus are lower for vaping than the rest of our region, and are lower than the state. So that is a positive, but it's still a concern. It's 1/3 of our teens at the high school level. For alcohol use, you can see that it's less than 1/3 that are involved in this. Marijuana, a little bit less than that, and prescription drugs, even less. So that gives you a feel for where the usage is among the different substances. The other thing to take a look at is for our 2 high schools in our coalition area, both of them are at or below what the state use rate is. But if you take a look at our region rate is higher, and that's something that we are concerned about. Next slide. We do know that depression and stress can lead to some uses of substances. So I thought it was important to take a look at this. And you can see the pale green, which is a new color here, represents middle school. And we only did that in the TAP. We only ask about depression and self-harm. We don't get into suicide with that age group. So if you take a look, you can see that roughly about the same number of middle schoolers as high schoolers are depressed. If we take a look at self-harm, middle schoolers are a little bit higher than high schoolers. Part of that is a little bit developmental. You see self-harm practices being done at that age group. I don't want to make this sound, well, I'm just going to say it. At the high school level, they have a tendency to move on to more serious things such as suicide attempts. And so that's why it's not unusual to see the self-harm higher in middle school. But if you take a look, the self-harm for high school is still significant there. You're looking at about 1 in 5. And if you look at suicide attempts, we are higher than the state, and our 2 high schools that we look at in our coalition are higher than the region. So those are definitely areas of concern. Next slide. We'll now take a look at a couple of the specific substances. Cessation of regular tobacco use is a success story. The rates have been dropping significantly. It's dropped from 25% 10 years ago to less than 10% now. That's a huge positive impact. The concern, however, is that for those that are smoking in that 8%, which is Keene High School, or 7%, which is Monadnock. It's twice as high in usage rate. In other words, twice as many are smoking 10 or more cigarettes a day. That is up from 13% to 30% in just 2 years. That's a huge concern. So those that have not stopped smoking regular cigarettes are smoking much more frequently. But also remember, the concern that we have is the 30% that are vaping. And what we don't know, because it isn't being tracked yet, is how many of those that stopped smoking regular cigarettes have turned on to vaping, and how much that are vaping are just new users. There isn't any way to separate that out yet. I would imagine, as vaping has only been tracked for 2 rounds of the YRBS, I would imagine in future years they might be sorting that out a little bit more to try to figure out who are the specific users within that. With alcohol trends, that also has been trending down, which we feel good about. The problem has been, if you take a look at the green line is on the bottom except for Monadnock. And if you take a look at the triangle, Monadnock was above it in 2013 and has dropped down below the state average. Keene High has come down and now from well above the state average is coming down to what the state average is. So there's positive things happening here. We're beginning to get a handle on it. But if you take a look, it's still about 1 in 4 of our teens that are drinking regularly, which is something that we want to continue to pay attention to. Next slide. And one of the concerns that we have is one of the big protective factors, when making catches up here, would be the next slide, Megan. There we go. This is a strong protective factor and it's dropping. Dropping in this case is not positive. We want to see the protective factor increasing, not decreasing. And so the perception of harm for binge drinking, which again is 4 or more drinks in a short period of time by a female and 5 or more by a male. If you think about, especially like 9th graders that might be 100 to 120 pounds, drinking 4 or 5 drinks in maybe a span of 1 or 2 hours, that's a huge impact. And if you take a look at the binge drinking rate, basically for those teens that are here, or for parents that are listening, think about at least 1 in 10 students that are sitting in your child's class might be under the influence of alcohol on Monday morning when they're sitting in class. Next slide. This is showing the impact that the protective factors can have. The green bar is parents saying that they feel it's wrong for their teen to use alcohol. The blue is friends of the teen saying it's wrong to use alcohol. And then the regular green is the usage rate. And this is done by grade level. So as you can see, the protective factors, the olive and blue, decrease by grade level. And what happens to the usage rate? The usage rate climbs. So we need to make sure that we're continuing to push on these protective factors. The parents regularly let their teens know that they don't approve of use of alcohol in teenagers, and that our friends, that our teenagers tell their friends, no, we don't think that people our own age should be drinking. Another problem that we have, which you'll see in the next slide, this pie graph is showing, once again, this is switching back to middle school now because they unfortunately don't ask this question and give us the results for high schoolers. Statewide, the source of alcohol for teenagers is usually buying or taking from a store or getting it from friends. In this region, that is not the case. In this region, the olive green is the 92% of middle schoolers that do not drink. That's a very strong positive. But the red, the gold, and the regular green are showing the percentage of students that are drinking and where they're getting it. The red is reflecting the middle schoolers who are taking it from their own home or from their friends' homes to drink. The gold is showing the students, the middle schoolers who are having it given to them by their parents. So the red is reflecting 3/4 of the middle schoolers who are drinking are getting it from their own or their friend's home. And then 25% of the drinkers are being given it by their parents. The regular green is showing that they're getting it from friends, and that's only representing 10%. This is not like the state. And this is one problem we have with the YRBS, because they're only reporting to us the percentage of students that are taking it from a store, which isn't the problem that we need to track in this region. So we need to work on the data being reported in different ways for regions that are tracking it differently. Next slide. For marijuana use, it's been static. There has been concerns because we know that there's talk of legalization. We know that the states around us have legalized marijuana. We know that the state of New Hampshire has legalized marijuana use for medical purposes. So that's giving a message to our teens that it must not be that much of a concern. So we're anticipating the usage rates are going to go up. They haven't yet, although you're starting to see the state, the green line is starting to trend up. And with Monadnock, it has started to trend up. If you go to the next slide, the protective factor for this is dropping. It has dropped significantly if you track back for 10 years. And so we're concerned about this. As the protective factors decrease, are we going to see more use of marijuana? The next slide, great use of protective factors for 2019. You can see here that there's room for us to work on improving these. The olive one is students who report, this is high schoolers, students that report that using alcohol regularly is very risky. We can certainly improve there with alcohol, with marijuana, and with prescription drugs. That certainly needs to go up. The regular green is friends who disapprove. There's room for improvement there, and take a look at the marijuana ones that are significantly lower than either prescription drugs or alcohol. The blue is parents who disapprove. 3/4 of our parents for marijuana. That has decreased over the last 8 years. 86 and 92% for alcohol and prescription drugs. The strongest protective factors for substances in this region is for use of prescription drugs that were not prescribed to the teenager. So that is a positive, but we need to get the others up just as high. And then if you take a look, the brown one is whether teens say it's easy to get access to these substances. The alcohol one has been decreasing. It used to be 50% said it was very easy. It's down to 33%. So some of the environmental things that we're doing, things like doing compliance checks with stores and everything is beginning to have an impact, but we still need to decrease that so that it still is seen as even harder to get. With marijuana, it's under 50%, and with prescription drugs, it's quite low, which is a positive. The next slide is other drug use. You take a look at, here's the prescription drugs. Once again, Monadnock, Keene High, the region, and New Hampshire. Prescription drugs, it's running around 10 to 12% with the different measures there. Synthetic marijuana is less, and then the harder core substances, which definitely we would be concerned about, is low. It's under 5%. Keene High is reaching 5% with ecstasy, which we'd want to keep an eye on. The concern, though, is our local drug enforcement agency is saying that New Hampshire is seeing an increase in methamphetamines coming in from Mexico, and they're coming in being disguised as popular prescription drugs, such as OxyContin, Xanax, and Adderall. And that's a huge concern because if you see these drugs on the street, students are saying, oh, well, you know, it's just going to be an Oxy or a Xanax. It's not that big a deal. They're not knowing what they're taking, as well as who knows what the other contaminants that may be in it are. And so there is a real concern that this is going to be the next wave that we're seeing in New Hampshire that we need to be paying attention to. And the last slide. So that was a quick overview of some of the things that the Youth Risk Behavior Survey and the Teen Assessment Project are telling us. Are there any general questions? Then the next thing would be, what surprises you or worries you about what you saw here? And people
I
can
think it's
use
interesting to look at the difference between Swansea and Keene in terms of how they're spending their time. I mean, you see the Swansea kids that had a lot more time, assumingly by themselves, without family or friends nearby, and then also a lot more depression, a lot more self-harm, and a lot more.
I should have pointed out too, although they're side-by-side communities, some of the difference that you're going to see in the percentage between these two high schools is the setting. Keene is more of it's not necessarily urban, but it's definitely more urban than Monadnock would be. Monadnock would be considered more rural. So students have access to different resources in Keene than they would in Monadnock. Students are more isolated in Monadnock. And so obviously their access to things is going to be different. So if you take a look at, for instance, the vaping, Keene High is going to be higher than Monadnock only because access is going to be less ready. Not all of the high schoolers have easy transportation. Yes, some of the juniors and the seniors might have transportation, but obviously the freshmen and sophomores won't. So the access to some of these substances will be harder for them. And so that's going to be some of the influence. It isn't necessarily reflection of the school itself. It's really more the environment the students are living in. So you need to kind of keep that in mind. That's the danger of comparing statistics between schools. You got to kind of keep in mind what the bigger picture is of the setting.
Oh, absolutely. Yeah. I mean, and I think that's sort of the thing to think about, I mean, I live in Swansea. So, I mean, I can tell you that finding a neighborhood to go walk in, for example, is hard to do, it's very spread out, and there's not a lot of access to anything. And it's not like it's not like yes, they're right next to each other, but it's not like kids can just go walk into Keene. That's still while they're next to each other, it's still a very long walk to get anywhere.
And for teens that are looking for a little bit more excitement than necessarily just a walk, I mean, that's why it's not surprising that you're seeing that there's more electronic use by the Monadnock students, because there's less access to something different than just walking around the block.
And this is Janine, because I echo the thank you so much for doing this, Lauren, because it really is helpful. And it's exciting that, since we started this, that we've seen some improvement, which is great. And I think the one of the things that concerns me is the depression. And because I think people, community members, parents, I think they do understand more about like vaping and alcohol and marijuana, that kind of stuff, but they don't seem to, or that the message about depression is not as concerning as those things. And so I think that's just I'm glad we have data to kind of show that, because you do see that. So that was it's surprising, I guess I'm trying to say, and not surprising, but I think it's great to have some data so that kids are saying that. That there's a lot of times there's that, just kind of suck it up thing. Even with this COVID thing, people are just don't worry about social emotional learning, just get them back in, just get them working. And, they're not listening. So I'm glad we have some data about that as well too. And it is interesting to see between the two. And sometimes, because we're thinking like access, we come up to, our district goes out to Fitzwilliam, for example, it's really wide, and being able to get, and kids have said that even from myself when I went there, that you're not around. There always consistently has been that message that there isn't things to do. Not that kids don't want things to do, but they can't access or get to them. So that would be something I think for us to take a look at too. And I know that happens in Keene too. I know their kids Marlowe. So our region is big, but really thank you for putting all this together. So we've got some stuff to move forward with. So.
And I want to remind people, these are the 2019 results. So this is well before COVID. It will be interesting if New Hampshire actually does do it in the fall, what the impact of students hopefully coming out of recovery from this pandemic, how much that's going to be influencing what some of the results are. And we won't know until it happens and until the survey is done and we get the results. I could see, because I'm seeing this on my phone, I can't see all of the chat, but you could put in the chat, and Peter can let me know who needs to have more information on this, and I can provide it via email for those that want it. But one more question I'd like to ask is, are there some things that come to mind of what the coalition can do to help continue to move this in a positive direction?
So, Lauren, I'm going to echo again, Janine again. I know that you've presented to school boards and things like that. So I would so like that to get back into that cycle of having you, whether it's, however we do that. It'd be nice actually to have the youth coalition now we have, and students at presentations too. But I think that's the other thing, audience, we should be starting to take a look at. I know the school boards aren't going to do it right now until we get back, but that might be something, or I don't know, maybe this summer, but I think we should get on those agendas so that we can start taking, getting that in as many places, maybe Rotary clubs, get all of this stuff out to people, because data, what you put together, that's what they want to see.
I would be very willing to, and I think it would be wonderful if we could be working with the youth members and have them participate as well. We could do it as a joint presentation. That would be wonderful.
Jen put in the chat that's increasing coping skills for youth around anxiety and stress. And certainly, I think one thing the coalition can have a part in is increasing protective factors across the board, whether it's, helping to educate people about stress and anxiety coping skills, or supporting some of those existing programs that are out there. One of the things that concerns me, Lauren, that you talked about is the decrease in the perception of risk. So I think, that is kind of a red flag, as we go through the pandemic and more adults are drinking, and with the legalization of marijuana all around us as well, that doesn't look good for that. And certainly the trends with anxiety and depression going into the pandemic again seem to be troubling.
So there could possibly be some messaging campaigns to both parents and to youth around some of those topics.
Thank you so much. Any other comments or questions for Lauren?
If I ask one, it's I'm trying.
Oh. Jay had a question.
Well, it's that. Sorry, there's too many things happening. The fall data is going to be really quite different, and it causes me to think about the kind of training that we are requiring in our schools around anxiety and depression, mental health issues. So I think this tees it up, but I think that we're not getting quite the picture that the counselors and family counselors are experiencing right now in the community. There's just there's an over demand and an under capacity. So equipping people with skills, I think, that's part of the suggestions that you've got here in the chat.
And one of the problems, Jay, is the lag time too. If they do the survey this fall, we likely won't see the results for a year or longer. So it's pretty hard to do fast response. It's really kind of doing some long-term planning for trends rather than really immediately responding to things that are identified as needed.
Lauren, is there any national data that correlates substance misuse and the issues we've been talking about with school funding?
I don't know about it connected to school funding. The statistics that I had here from the YRBS, you can compare them to any other state. The CDC has that stuff up online, so you can compare us to any of the other state results to see where we stand with.
I got to
But I-
tell you, as a parent of a middle school student who just moved from Texas, that's one of the better states, moving to New Hampshire, that really gives me pause as we think about what to do, where Katie should go to high school. It
Right, but the
really
thing,
gives me pause.
remember that slide that I started with that said the majority of our teens are not, we took
Yeah.
a delve into the highest at risk at the end of the presentation. The majority of them are living healthy lives, making positive choices. So the important thing that we need to get out to families as well is this is not the norm for all children. And it's important to continue to be engaged with your child, to have your child engage with their peers, to be involved in positive activities, all things the Y Coalition talked about, so that those positive choices are out there for them and they aren't as influenced by some of the negative parts of their peers.
Yeah, I'm glad you put that slide in there, Lauren, because that really is always important to look at the positive side and how many youth are choosing to live healthy and choosing not to use substances. We need to always keep that in mind. So thank you for putting that in. Any last questions? I know there was, some questions in the chat. Lauren, I don't know. I think there was something about free transportation would be a great resource. I know there is a group in the greater Monadnock region working on that. And like a lot of groups during the past year, it's been a little bit harder to meet, but that is a goal, is to provide affordable public transportation for youth. So I don't think that's going to go away. Right. Thank you. I